For my lightning strike presentation, I decided to look at the benefits of using staples over stitches and tissue adhesives to heal lacerations in the athletic population. My rationale for comparing the other methods to staples is because of their frequent use in Longwood athletics. While working in the athletic training room at Longwood, I have seen multiple athletes receive staples following surgery, most commonly for ACL reconstruction. The main objective is to restore the integrity of the skin while reducing the infection, scarring, and functional impairment rate, while also achieving adequate healing with minimal wound complications, pain, costs, and satisfactory cosmetics. The exact frequency of lacerations in athletes is difficult to determine because many athletes do not seek medical treatment at all or by their athletic trainer. There are multiple mechanisms to close lacerations, which include staples, sutures, also known as stitches, and tissue adhesives. First, I'm going to talk about stitches. These are the most commonly used, and there are different application methods, including intermittent, continuous, blanket continuous, and retention, but the most common method used is intermittent. There are two different types of sutures, which include absorbable and non-absorbable. Both are flexible, strong, and non-toxic. The advantage of absorbable sutures is that the patient does not have to receive additional medical attention to remove the sutures, which results in less missed time from work or school. These types of sutures were previously only used for traumatic facial lacerations and surgical repairs, but are now more commonly seen to heal acute lacerations anywhere on the body. Non-absorbable sutures are removed with forceps and scissors. Sutures are commonly used with lacerations that have jagged edges or are in areas that are oily, hairy, or subject to contact with clothing. Next, I will talk about the use of staples in healing lacerations. These are commonly used when a quick fix is needed. This is a much faster application than sutures, and they hold just as well, which is commonly why patients who have lacerations on their scalp receive staples. The closure time is much faster, resulting in a decreased chance of infection and blood loss. It is easier to apply staples to a straight laceration than one with jagged edges. Staples have a fairly simple and pain-free removal process, where a staple remover is used to pinch and bend the staple, which allows it to be pulled out of the skin. Finally, tissue adhesives come in multiple forms, including skin glue, like Dermabond, and steri-strips or wound tape. These work best with straight, superficial, low-tension lacerations. They allow for a quick application and can be used to reinforce staples or sutures. They can also be applied on the field and used until the athlete can receive further medical attention. A common use is following the removal of sutures or staples to reinforce the healing process and to make sure the laceration does not open back up. Evazo et al. Conducted a study where they actually found that patients who received staples had more pain at the time of removal as well as short-term and long-term follow-up. However, the infection rate was lower in those who received the staples compared to those who received sutures. Staples were also superior to sutures in regards to the closure time and cosmetic outcomes. So overall, the patients showed a higher satisfaction rate with the sutures, despite their prolonged pain. Athletic trainers have a very important role in managing these lacerations until the athlete is able to receive advanced medical attention. It's not within the scope of practice for an athletic trainer to suture or staple athletes, but it is within it to apply tissue adhesives. Beam says that tissue adhesives are available to athletic trainers without a prescription, but use in the management of traumatic lacerations may be restricted based on state credentialing and scope of practice laws. With this being said, athletic trainers should check what is and is not within their scope of practice and should have their kit stocked with minimal supplies, including gloves, gauze, steri strips, band-aids, tape, and proper cleaning solutions.